Hello, friends. Dave Bjork here, lung cancer survivor, patient advocate, and host of the Research Evangelist podcast. I just got back from the ASCO annual meeting in Chicago. It's the largest oncology conference in the world. And this is the second in a series of short interviews I'm doing to provide some interesting research from ASCO for patients who could not attend. This series is supported by an unrestricted educational grant from Nuvation Bio. And today I've invited my friend, Dr. Sanjay Popat, who is a consultant thoracic medical oncologist at the Royal Marsden Hospital, to share his thoughts on the the ROSETTA Lung-02 abstract from the conference. So welcome to the show, Sanjay.
Dave, great pleasure to be chatting to you again.
Awesome. It's great to see you. So why don't we just start by having you tell us sort of what are the key takeaways that patients should learn from this study?
So I think the main takeaway is that we as investigators were evaluating a new drug called permitamig, and this is a immunotherapy-based drug which has a novel action. So not only does it work like the pembrolizumab that we are used to, pembrolizumab's a PD-1 inhibitor. This is in fact similar. It's a PD-L1 inhibitor, but it actually has an additional immune action as well by blocking VEGF. So it's sort of like to think about it like Pembro Plus. And this is one of the more advanced drugs in this new wave of drugs that's coming through to hit both PD-1 or PD-L1 as an immunotherapy and also hit a new target called VEGF, which we think enhances the activity of immunotherapy. So the key issue is, does it really work and is it safe to do so? And so this was a reasonably sized trial done in many regions around the globe where they took frontline advanced metastatic non-small cell patients that didn't have a driver mutation. And these are patients in whom we would normally give chemo together with pembro as one of a standard treatment. And they were randomized to have that chemo and pembro or the new cocktail, which is the same chemo, but instead of pembro, the new drug, permitamig. So it's really testing whether permitamig is worth taking forward in this setting. It's not a definitive randomized phase 3 study, but it's a sort of early signal to see, does it really work? And, is the bang worth the buck, right? Are the side effects, acceptable and satisfactory? They're also looking at what the right dose is. So inbuilt within that, there were a couple of different doses. The bottom line is they showed that the drug was effective and the activity that they demonstrated, the proportion of patients in whom the tumor shrunk was really quite large and was beyond what they had seen or we had seen with the activity of chemo together with pembro. And not only was that the case, but the depth of response, how deep the shrinkage got, and how long the shrinkage went on for, also seemed to look quite impressive as well. One of the problems that we've had with thinking about how we bring this whole new class of drugs in is what is the side effect profile, right? Because if you're going to be using a drug with a different mechanism of action, you're going to be getting different side effects. So, is this bearable? And actually, what we identified is actually in the vast majority of people, we weren't seeing a huge increase in additional side effects. Because the drug hits something called VEGF, it has a propensity to potentially lead to bleeding or other side effects such as high blood pressure or kidney effects. And actually, what was really encouraging is we weren't seeing a big excess of VEGF-related side effects. So what that tells us overall is we've got a new interesting drug coming through, a new kid on the block. And the early part of the trial was to optimize the dose to see the safety, to see the potential efficacy, and I think it's ticked all those boxes. And so now the trial is carrying on and is going to be bigger and is going to be in many centers, and it's going to be the definitive study to prove whether this drug is really better than chemo and pembro. So very, very encouraging, very exciting, and I think a lot of people are very, very pleased to see these data.
So this is going into phase 3, or
Yep,
it's already in phase 3?
yep, yep,
And
yep.
what patients is this for? What can you give me kind of the profile of the patients that?
Yeah, yeah. So to go into this study, you had to have non-small cell lung cancer, and it didn't really matter whether you were squamous histology or non-squamous histology, like adenocarcinoma. Both could have gone in. And that's really important, right? Because it covers everyone. But what was really important is that you couldn't have gone in if you had an actionable genomic alteration like EGFR or ALK. You need, I mean, because obviously those patients you want to treat them with a targeted agent, right? You don't want to treat them with chemoimmunotherapy. So it's for the group of patients that don't have a genetically altered target, where normally you would either be using pembro by itself or pembro with chemo as a typical standard of care. And of course, you had to have good performance status. You had to be fit, active, independent, and you couldn't have active brain metastases because we don't really know so much about the safety of this in patients with brain metastases. So that's always a limitation in this type of study. And uh, that's the typical sort of patient that gets enrolled into an immunotherapy type of study. That's the type of patient that we were taking, Dave.
Yeah. So this is really exciting information for me. So I saw the presentation in Chicago, and I'm the research evangelist, but I don't, I'm not an expert. So that's why it's always good to have people like you come explain these kinds of things. And I know I had another conversation the other day with uh, Dr. Hanna from Indiana University, and he's like, I said, ask, for his top three. He says, well, it's hard to pick three because there's probably six or eight, that really, even one I think that got a standing ovation at ASCO. So anyway, thank you so much for being on the show, Sanjay. It's always great to see you, and I always appreciate your time, and thank you for all you do for the lung cancer community.
Absolute pleasure.